Hi and welcome to my second vlog in the Skills and Capacities for SAC7108. This time the vlog is in a speed and agility setting. The aims of this video are to assess two athletes' ability at performing a speed and agility task. One athlete will present with a skill issue and the other with a capacity issue. The speed task will be the standing 10-yard sprint and the agility drill will be the 5-10-5 drill, often seen in the NFL Combine. Specifically, we're looking at the kinematics and how they perform these tasks relevant to our technical models. Once demonstrated, I will aim to establish means of enhancing the kinematics to achieve a better result from the task. For our skill, we are looking for execution as close to our technical model as possible, whilst demonstrating high levels of control over the movement and completion of the task required. Meanwhile, capacities, we are analysing our athlete's ability to complete the task required without hindrance or restriction from either muscular, structural or neurological issues. Our first athlete is a female football player, looking back to playing up postpartum. We can see here from her standing sprint start, she has a decent start position, but when she takes off, she is running with low ankles and is essentially ankling and has a angle here of 52 degrees, which is pretty good, but the ankles do come very low, the knee doesn't straighten, we don't achieve triple extension through the run, the ankle doesn't travel above the knee drive is not particularly high, and the arms also do not come up particularly high. We can see from this still that the knee only comes to a 91-degree angle. We would like it much greater. To achieve this better kinematics, we've intervened by adding in a sled push, where the focus is high knees, the toe landing under the hip and getting a really good drive. We can see in this second attempt at running where we do get a much straighter leg angle, much more triple extension. We also achieve a higher knee angle coming up, and the ankle comes much higher past the knee, and that is after intervening with just the one exercise. The second exercise we intervened with was a high knee drill, again just driving off the toes, trying to get the movement going. And we can see in this still that the knee comes past a much higher point, and we have used the same still point, the same running point for both stills. Athlete 2 is a male athlete wanting to improve at American football, and in particular speed and sprinting ability. His capacity issue will be noticeable due to the presence of congenital talipes, also known as clubfoot. In a normal foot, as it goes into varus, the calcaneus adducts and inverts under the talus, while the cuboid and navicular adduct and invert in front of the calcaneus and the talar head. Research by Farabuff explained that in the talipes deformity, the ossification centre of the talus responds to the abnormal pressures placed on it by the displaced navicular that occurs with this condition, therefore fusing the ankle joint, thus preventing the plantar flexion movement. This is obvious by the way the ankle and foot moves during running and agility presented here. What we can see here in this circle is a very flat takeoff, and a false step will be presented to get the sprint started. This is due to the lack of elasticity in the Achilles complex. We also see a good sprint angle, but the arm swing is very low. Again, the feet travel low. The distance from the heel to the glutes is 47 centimeters, which is quite low. We would like the Achilles to come much higher, and the knee drive again is representing quite low. Are coming from compensation strategies used to compensate for the talipes, and therefore the inability to extend the ankle and utilize the soleus. Other issues we are seeing is that without the elasticity of the Achilles complex, due to not being able to maximize the tension and lever length through the foot, it is very difficult to represent with an explosive takeoff action, hence the false step. We also are seeing an over-recovery, causing a large gap between the foot and the backside in the swing leg. It is important we work on the hip flexors and adductors. The rectus femoris and sartorius will also be placed under unnecessary load, and this movement pattern prevents us from being able to recover the optimal position with appropriate knee height for effective sprinting. Having watched other athletes who compete at a high level with the same or similar condition, it seems very important to utilise the recovery phase, as even Paralympic sprinters in the T44 class who have this condition do not match their counterparts for the height of knee drive. One of the interventions added here was the falling sprint. We can see here that he leans forward and then drives without the false step and achieves a much greater height from the ankle, crossing over the knee joint, which is what we're after, bringing the heel up much higher, getting a nice acute angle of 38 degrees. And this is just after one drill. Sayers and Binkley define agility as the ability to change the direction of the body rapidly using a combination of strength, speed, balance and coordination. The 5-10-5 drill is a change of direction speed drill, and we are looking at agility in respect of a predetermined location and distance as opposed to a reactive agility drill. The 5-10-5 drill is used routinely in American football and even form part of the combine testing. Athlete 1 has never performed this drill before, whereas my athlete 2 has performed this drill before as part of American football training. Therefore, issues we would see would be down to capacity rather than a lack of familiarity. We can see through this first frame that the athlete is already defaulted to a technique of focusing on lifting the head as opposed to driving explosively through the legs. She also does not employ a crossover movement, which is regarded as a more optimal movement for initiating in this drill. This is probably due to not having performed the drill or crossover technique on a regular basis. However, the first turn we can see a technique breakdown as the turn is initiated. The inside turn hand that is circled is being used for the touchdown, which will cause a slowing in the turn as well as a suboptimal positioning. We can see the cramped nature of the turn position and the inside foot still pointing in the direction of the run, thus difficult to transfer enough force onto the inside leg to gain a good push-off. We are also at greater risk of injury due to having to implement the use of the ligamentous tissue and its elasticity to stabilise and decelerate the body, opposed to using a higher amount of musculature that can be achieved when we are in good positions and posture. However, we can see in the second turn a much better body position with the centre of mass over the front leg, able to drive. As we run through, we can see a low ankle not coming past the knee with a shallow distance. The simple cues given were to drive with the legs, use the outside hand for the touch, push off the inside leg for the turn, and ankles over the knee when running. We can see here on this second attempt a much more lateral movement at the start, taking off much greater, the centre of mass over the inside foot on the turn, touching down with the outside hand. We can also see the same on the other side with the feet pointing in the correct direction, and a fast, better turn, better push off, heels coming up higher and a higher knee drive, and we can see the distance from the heel to the glutes in the next still is much more acute than the previous attempt. The side-by-side still we have here on the turn really demonstrates the difference between the first and the second attempt, and how much of a better position to push off that inside leg we have. We also can see the difference in the recovery leg in this second still and the greater angle achieved on the same stride in the running pattern. During our agility drill for our athlete with a capacity issue, we see again a false step on the inside leg and the turn. We also see a very early turn into that leg. The good position on the turn, inside leg, with a lot of centre mass over it. We do generate a small false step on these as well. We see a good lean, but we can also see the foot landing flat down due to the talipes condition. Again, a decent turn, but braking very early, and also we can see the foot having to turn and a false step occurring here. As he comes up, again, the heels do not come up high enough. They are very low, just passing through mid-shin, and only starting to get higher as he starts to stand up. One of the interventions we introduced for this athlete is the ski step. We can see here that on the ski step he has a nice flat foot and a nice low angle to push off of. This is to encourage that flat foot and pushing off the inside leg on the turn and preventing that false step. We can see here the foot on the step has to stay planted and he has to drive off the inside leg. The advantage of this is it mimics the turn, and we can see here the turn done directly after the ski step. That inside foot plants, stays down, pressure goes on the leg, really good turning angle, much better angle to push off of, and as he pushes off, the foot doesn't false step and he can drive through and get away much faster. We can see from this still the improved turn position. The image on the right is the improved turn position with a much better foot angle and much more pressure on the inside leg, allowing a greater push off and a faster turn. Thank you for watching, and see you on the next vlog.